All right, today we're jumping right into a real medical mystery. We're going on the hunt for a condition that can secretly push your body's engine into overdrive. It's a silent saboteur, and it is an absolute master at hiding in plain sight. Let's start the investigation. Think about it for a second. That feeling of persistent anxiety, a heart that just flutters and races for no apparent reason, or maybe just a brain that feels foggy, unfocused. It's so easy to write these off as separate issues, right? Just symptoms of a stressful modern life. But what if they're not separate at all? What if they're all clues, all pointing to a single hidden culprit? Well, that is the puzzle we are going to piece together today. And right at the heart of this mystery is this tiny, butterfly-shaped gland at the base of your neck, the thyroid. Now, don't let its size fool you. This little thing has a huge job. It's basically the master regulator of your body's metabolism. It's the gas pedal, telling your body how fast to burn energy, how fast your heart should beat. It pretty much sets the pace for every single cell in your body.
Now, to do its job properly, the thyroid is part of this really elegant system called the HPT axis. Think of it like a smart thermostat for your body. Here's how it's supposed to work, in perfect balance. First, the brain, specifically the hypothalamus, gives the pituitary gland a little nudge. The pituitary then sends out TSH, that's thyroid-stimulating hormone. TSH is basically the go signal, telling the thyroid to release its hormones, T3 and T4. And when the levels of T3 and T4 are just right, they send a signal back to the brain that says, hey, we're good here, you can cool it. And the brain lowers TSH production. It's this beautiful, self-regulating loop. But this is where our saboteur, hyperthyroidism, comes in and just throws a wrench in the whole system.
And this is where our investigation gets really interesting. See, the problem is, an overactive thyroid doesn't always show up waving a big red flag. Oh no, it is a true master of disguise, and it can present with this bewildering array of symptoms that can send doctors and you looking in completely the wrong direction.
This whole paradox is just perfectly captured by Dr. Udaya Kabati, who pointed out that even though classic hyperthyroidism is super easy to spot, the diagnosis gets missed all the time. And why is that? Because it just creeps up on you so slowly, and its disguises, well, they're incredibly convincing.
So, let's just shatter a big myth right now. The classic stereotype of hyperthyroidism, right? It's someone who's buzzy, hyperactive, can't stand the heat, maybe losing weight even though they're eating a ton. But look at the reality. Especially in older adults, it can show up as the exact opposite. It's called apathetic hyperthyroidism. We're talking lethargy, depression, even a loss of appetite. It looks so much like something else, like just getting older, that the real diagnosis can be completely missed.
And the disguises, they get even more specific. An overactive thyroid can literally masquerade as a disease of a completely different part of the body. It can look like a heart condition, a chronic anxiety disorder, some kind of GI illness, or even something called masked kidney disease. Let's unmask a couple of these right now. First up, the heart. This is a big one. In older adults, hyperthyroidism can just pop up as brand new atrial fibrillation, that's irregular heartbeat, or even congestive heart failure. So a doctor might go searching for the usual suspects, heart disease, high blood pressure, and find absolutely nothing. In these cases, the thyroid isn't just part of the problem, it can be the only cause of these really serious heart events.
Then you've got the anxiety mask, and this is so important. Get this, as many as 1 in 20 people who show up with new anxiety or panic attacks might actually have an underlying thyroid disorder that's driving it all. It's not just in their head, it's in their hormones, creating this state of physiological overdrive that feels exactly like a primary anxiety disorder.
And this one is fascinating. It just perfectly shows how tricky this condition can be. An overactive thyroid can actually make your kidney function look better than it really is. It revs up blood flow so much that it artificially boosts this key number called the eGFR. And the result? Any underlying chronic kidney disease can be completely hidden or masked. The second you treat the thyroid and the body's engine slows back to normal, boom, the true lower kidney function is revealed. It's a total diagnostic trap.
So, with all these incredible disguises, how in the world do you crack the case? Well, you have to look past the misleading symptoms. You have to go searching for the hard evidence, that first clue hidden away in the body's biochemical code.
And that first clue, that first breadcrumb on the trail, is often a state called subclinical hyperthyroidism. This is the absolute earliest footprint the saboteur leaves behind. Remember that feedback loop we talked about? Well, in this state, the pituitary gland is the first one to sound the alarm. It senses just a tiny bit of excess thyroid hormone, and it starts dialing back the TSH signal. Now, at this point, your main thyroid hormones, T3 and T4, are still in the normal range. But that low TSH, that's the very first whisper that the balance has been broken.
And here's the thing, not all low TSH is the same. We can actually grade it. In grade 1, the TSH is low, sure, but it's still detectable. In grade 2, it's suppressed way down, to less than 0.1. And this is a really critical difference, because a more suppressed grade 2 TSH, that's a much louder warning bell. It signals a much higher risk that this thing will progress to full-blown hyperthyroidism, and a greater risk for problems like atrial fibrillation.
Okay, so we found the culprit's biochemical fingerprint. Now let's connect the clues. How does this one little hormonal imbalance set off such a massive cascade of seemingly random symptoms? Well, this is the body's domino effect in action.
This is how those dominoes fall. That racing heart, that's because excess thyroid hormone makes your heart cells way more sensitive to adrenaline, basically putting your heart on high alert 24/7. That anxiety and irritability, it's not just a feeling. The hormonal overload is literally disrupting the delicate balance of your brain's neurotransmitters like serotonin and dopamine. And that bizarre tired but wired feeling? That happens because while your metabolism is floored, your body is also breaking down muscle protein, which leads to this deep weakness. And the mental fog? Yep, excess hormones are directly interfering with how your brain processes information. Every single symptom has a direct physical cause.
So what's actually causing all this chaos? Well, the most common culprit, in about 70% of cases, is Graves' disease. This is an autoimmune condition where your own immune system gets confused and starts stimulating the thyroid. Other causes can be overactive nodules, or just inflammation of the gland itself, which is called thyroiditis. Figuring out the root cause is absolutely key, because that's what determines the right path for treatment.
Which brings us to the resolution of our mystery. When you're dealing with a saboteur this good at disguise, how do you make sure it gets caught? Well, it all comes down to one crucial thing.
Take a look at this diagnostic flowchart. At first glance, it looks incredibly complicated, right? A total web of decisions and branching paths. But look closely. Look where this entire complex journey begins. It starts with one single sensitive clue, a low TSH. From that simple initial finding, the entire investigation unfolds, and it's what guides you to the right tests and ultimately the right diagnosis.
And that's really the most important takeaway. Unmasking this great imitator isn't about memorizing 100 different symptoms. It's about having what clinicians call a high index of suspicion. It's about seeing that collection of vague or weird or atypical symptoms, especially in an older person, and just asking the simple question, could this be the thyroid?
And this whole thing is such a beautiful illustration of a deeper truth. Our bodies are in this constant state of maintaining a delicate, unseen balance. And what hyperthyroidism teaches us is that sometimes the quietest, most subtle signals, a slightly low TSH, a little bit of fatigue, a touch of anxiety, can actually carry the most important messages of all.
It really makes you wonder, doesn't it? What other great imitators are out there, hiding behind symptoms that we might just dismiss as a normal part of life? The mystery is always there, just waiting to be solved.